Rheumatoid arthritis is a chronic autoimmune disease that primarily affects the joints. It causes inflammation, pain, and stiffness, often leading to significant disability if not properly managed. In this video, we'll have a look at the causes, signs and symptoms, diagnosis, treatment, and complications associated with rheumatoid arthritis. Understanding the causes of rheumatoid arthritis is crucial in developing effective treatment strategies. While the exact cause remains unknown, several factors contribute to the development of this condition. One of these factors is dysregulated immune system. Rheumatoid arthritis is primarily an autoimmune disease, meaning the body's immune system mistakenly attacks its own tissues. In rheumatoid arthritis, the immune system targets the synovium, a thin membrane that lines the joints, leading to chronic inflammation and joint damage. Environmental factors, such as infections or exposure to certain substances, may trigger the onset of rheumatoid arthritis in individuals with a genetic predisposition. Smoking, for instance, has been linked to an increased risk of developing rheumatoid arthritis. Additionally, hormonal changes in women, particularly during pregnancy, can influence disease activity. Research suggests that genetic factors play a significant role in the development of rheumatoid arthritis. People with specific genetic markers, such as the HLA-DRB1 gene, have an increased risk of developing the disease. However, not everyone with these genetic markers will develop rheumatoid arthritis, indicating that other factors are also involved. Recognizing the signs and symptoms of rheumatoid arthritis is essential for early detection and prompt treatment. The condition typically manifests in a variety of ways, affecting multiple joints and potentially other body systems. Persistent joint pain and stiffness are hallmark symptoms of rheumatoid arthritis. The pain is often worse in the morning or after periods of inactivity and improves with movement. It commonly affects the small joints of the hands and feet, but larger joints like the knees, hips, and shoulders can also be involved. Inflammation of the joints is a key characteristic of rheumatoid arthritis. Affected joints may become swollen, tender to the touch, and warm. This swelling can be symmetrical, meaning it affects the same joints on both sides of the body. Many individuals with rheumatoid arthritis experience persistent fatigue and generalized weakness. The exact cause of this fatigue is not fully understood but is believed to be related to the chronic inflammation and the body's immune response. Morning stiffness lasting for more than an hour is a common symptom of rheumatoid arthritis. It can make it challenging to carry out daily activity, and the stiffness may also return after prolonged periods of rest or inactivity. Rheumatoid nodules are firm lumps that form under the skin in some people with rheumatoid arthritis. They commonly appear near pressure points, such as the elbows or heels. While usually non-painful, they can occasionally become inflamed and tender. In addition to joint-related symptoms, rheumatoid arthritis can also cause systemic symptoms. These may include low-grade fever, weight loss, loss of appetite, and a general feeling of being unwell. The pattern of rheumatoid disease can be of insidious onset, meaning it is slowly progressing and forms the majority of the cases. It can also have an acute pattern, that is severe acute polyarthritis, usually with quick remission. The other pattern is known as palindromic, that is characterized by recurrent acute episodes of arthritis, stiffness lasting a few hours or days. And finally, it can be systemic, that is characterized by fever, weight loss, profound fatigue usually without joint symptoms. Accurate diagnosis of rheumatoid arthritis is crucial for initiating appropriate treatment and management strategies. Healthcare professionals employ a combination of clinical assessment, laboratory tests, and imaging studies to diagnose rheumatoid arthritis. A thorough medical history, including a discussion of symptoms and their duration, is the first step in diagnosing rheumatoid arthritis. A physical examination will be conducted to assess joint tenderness, swelling, and range of motion. Additionally, the presence of other systemic symptoms will be evaluated. Blood tests are often used to support the diagnosis of rheumatoid arthritis. The presence of specific autoantibodies, such as rheumatoid factor and anti-cyclic citrullinated peptide antibody, can help confirm the diagnosis. Elevated levels of inflammatory markers, such as C-reactive protein and erythrocyte sedimentation rate, may also be observed. Imaging studies, such as X-rays, ultrasound, and magnetic resonance imaging, are useful in assessing joint damage and monitoring disease progression. These tests can reveal characteristic features of rheumatoid arthritis, including joint erosion, cartilage loss, and synovial inflammation. To ensure consistency in diagnosis and research, healthcare professionals often refer to classification criteria such as the American College of Rheumatology, European League Against Rheumatism criteria. These criteria consider various clinical and laboratory parameters to classify rheumatoid arthritis. A score of 6 or more out of a total of 10 points is considered sufficient for the classification of rheumatoid arthritis. It's important to note that these criteria are not intended to be used as diagnostic criteria, but rather as classification criteria for research studies and clinical trials. Treating rheumatoid arthritis involves a multidisciplinary approach aimed at reducing pain, reducing inflammation, prevention of joint damage, maintenance of function, control of systemic involvement, while improving overall quality of life. The treatment plan may include medication, physical therapy, lifestyle modifications, and in some cases, surgery. Medications form the cornerstone of rheumatoid arthritis treatment. The choice of medication depends on disease severity, response to previous treatments, and individual patient factors. Commonly prescribed medications include nonsteroidal anti-inflammatory drugs. These medications help reduce pain and inflammation, but do not slow down the progression of rheumatoid arthritis. Some of the NSAIDs used for rheumatoid arthritis include acetylsalicylate, which is the aspirin, diclofenac, indomethacin, etorixib, and piroxicam. Disease-modifying antirheumatic drugs are the mainstay of rheumatoid arthritis treatment. They work by suppressing the overactive immune response and slowing down joint damage. Methotrexate is a commonly prescribed disease-modifying antirheumatic drugs. Others include gold compounds, D-penicillamine, the antimalarials, and sulfasalazine. Biologic response modifier, also known as tumor necrosis factor blockers or anti-TNF. Biologics target specific components of the immune system involved in rheumatoid arthritis. They are often used in combination with disease-modifying antirheumatic drugs. They include adalimumab, commonly marketed as Humira, certolizumab pegol, also known as Cimzia, etanercept, known by the brand name Enbrel, golimumab, also known as Simponi or Simponi Aria, and infliximab, that is known by the brand name Remicade. Corticosteroids provide short-term relief from pain and inflammation. They are typically used during disease flares or as a bridge therapy until other medications take effect. Prednisolone is an effective oral glucocorticoid used for managing symptoms of rheumatoid arthritis. Physical therapy plays a crucial role in managing rheumatoid arthritis. A skilled physical therapist can design a customized exercise program to improve joint flexibility, strength, and overall function. They may also incorporate modalities like heat or cold therapy and assistive devices to alleviate pain and improve mobility. Certain lifestyle modifications can help individuals manage rheumatoid arthritis more effectively. These may include regular exercise. Engaging in low-impact exercises, such as swimming or cycling, can help improve joint flexibility and reduce pain. Eating healthy, well-balanced diet rich in fruits, vegetables, and omega-3 fatty acids may have anti-inflammatory effects and support overall joint health. Chronic stress can worsen rheumatoid arthritis symptoms. Practicing stress management techniques like deep breathing, meditation, or engaging in hobbies can help reduce stress levels. In severe cases of rheumatoid arthritis where conservative treatments have failed to provide adequate relief, surgery may be considered. Joint replacement surgery, such as total hip or knee replacement, can alleviate pain, improve joint function, and enhance overall quality of life. Rheumatoid arthritis is a complex condition that can lead to various complications affecting multiple body systems. Understanding and addressing these complications is vital in managing the disease effectively. Over time, rheumatoid arthritis can cause joint deformities and functional impairment. As the disease progresses, the joints may become misaligned, leading to deformities like swan neck deformity or boutonniere deformity. People with rheumatoid arthritis are at an increased risk of developing osteoporosis, a condition characterized by weakened bones. Chronic inflammation, long-term use of corticosteroids, and reduced physical activity contribute to bone loss in rheumatoid arthritis. Preventive measures, such as adequate calcium and vitamin D intake and regular weight-bearing exercises, are essential to reduce the risk of fractures. Rheumatoid arthritis is associated with an increased risk of cardiovascular disease. Chronic inflammation can affect the blood vessels and lead to atherosclerosis, increasing the likelihood of heart attacks and strokes. Managing cardiovascular risk factors, such as high blood pressure, high cholesterol, and smoking, is crucial in individuals with rheumatoid arthritis. Some individuals with rheumatoid arthritis may develop eye complications, including dry eyes, scleritis, or uveitis. Regular eye examinations and appropriate management are essential to prevent vision loss. Rheumatoid arthritis-related inflammation can also affect the lungs, leading to conditions such as interstitial lung disease or pleurisy. Individuals with arthritis should be monitored for respiratory symptoms, such as shortness of breath or persistent cough, and receive appropriate evaluation and treatment. Due to the dysregulated immune system in rheumatoid arthritis, individuals with arthritis may be more susceptible to infections. Certain rheumatoid arthritis medications, such as biologics, can also increase the risk of infection. It is crucial to follow appropriate vaccination schedules and take necessary precautions to reduce the risks of infection. Early diagnosis and appropriate treatment are essential to prevent joint damage and manage the condition effectively. Through a combination of medication, physical therapy, lifestyle modifications, and surgery, individuals with rheumatoid arthritis can lead fulfilling lives with reduced pain and improved quality of life. If you or someone you know is living with rheumatoid arthritis, remember that you are not alone. Seek support, connect with others, and never hesitate to reach out for help. Thank you for watching. Spread awareness by sharing this video with your friends and family. Don't forget to hit the subscribe button and notification bell if you haven't already. Until next time.